I'm seeing these days a lot of conversations about blepharoplasty. Can we talk a little bit about bleph? Like, what's the difference between upper and lower? What are the benefits? Who's a good candidate? And I think, for me, I thought that I needed one, and I didn't need one. I got a few other things but I think that when we're talking about fads and we're talking about aesthetic ideals and beauty goals, like you pointed out, which should be a conversation with your surgeon, we're thinking about what everyone is having done, whether it's the facelift or whether it's the eyebrow lift, whether it's the fox eye, which is so aesthetic and not really purposeful for a lot of people. But blepharoplasties can be both medically necessary for some patients and aesthetic, which I think meets a lot of the goals of what you do at Breast Surgery Group, meeting medical necessity with aesthetics versus sometimes something being wholly aesthetic.
Right.
Talk to me a little more about blepharoplasty.
Yeah, so one, you bring up a great point. So the spectrum of aesthetics and reconstruction is just that, it's a spectrum. And so even yesterday I had a patient who said, my breast bothers me and I just don't think it's a reconstructive thing. I think of it as like completely aesthetic, even though it's medically necessary. I know it's necessary, but I'm thinking like, it's an aesthetic thing. So I'm just like trying to really understand like, why do I really need this? And again, it's like, what bothers you? So in terms of the upper eyelid, which is, a blepharoplasty really refers to usually skin excision on the upper lid or the lower lid. And so the upper lid and the lower lid are interrelated but different procedures. So the upper lid, commonly, there's a little bit of droopy skin and it's related to the brow. So sometimes it's that you need a brow lift and not necessarily an upper lid lift. And so, the most important thing is we do an accurate medical assessment based on your anatomy, because if you manipulate the brow and you elevate the brow, it's possible that you don't need any skin excised on the upper lid. And you don't want to, if the brow's in a not great position and then you just focus on the upper lid only because of the droopy skin, you may end up excising too much of the skin. And so if the brow was in the ideal position, which for in the male population is typically along the orbital rim, and typically in the female population it's above the orbital rim. The brow position is really important for understanding like periorbital dynamics, and that's the thing to focus on first before the upper lid. The upper eyelid then, once the brow's in a good position, will be addressed. And the upper lid, sometimes it's medically necessary to excise just because it's getting in the way of the vision and visual fields. And so if it does occlude some of the vision, especially on the tail or the lateral part of the brow, then we can, basically make an incision on the upper lid, create a well-defined crease, sometimes address a little bit of the fat on the inner part of the eyelid, and then it's a very easy procedure. Takes like not much time, 30 minutes or so. It can be done under local anesthesia.
You can do a blepharoplasty under local anesthesia?
That's right, yeah. So it's, you come to the clinic, we make you comfortable, play your favorite music, give a little bit of numbing medication and an injection, and then you just relax. We make some markings, excise the skin, and you're done.
Wow.
So the recovery is, not bad at all. There will be swelling and bruising, of course. But overall, it's pretty pain-free. It's easy. People are extremely happy with that procedure. But again, it's very related to the brow position as well. And then, the upper lid. Now, the other thing to mention is that sometimes it's not just skin. Sometimes it's related to muscles underneath that as well, or even fat pockets that may be herniating. And so blepharoplasty or upper eyelid lifts may not just be skin only. They may be skin, they may be muscle, they may be underlying fat pockets. So we try to address all of it at that same time.
So come in and speak with Dr. Vias about your eyelids and your eyebrows, and he'll get you together.
No, we can. I'll answer the other part of the question, which is the lower eyelid.
Mm-hmm.
So the lower eyelid is not medically necessary. That's more of an aesthetic procedure. So that one's not covered by insurance. But a lot of the times people are also bothered by some fat herniation along the lower eyelid, kind of trying to blend in the cheek to the lower lid, which are separate but similar, anatomic structures that are interrelated. So. That procedure is less commonly done under local anesthesia because it's a little more uncomfortable. There are different nerves innervating like different areas of the lower lid. Some people will do it. The bleeding risk is a little higher in that area, and I think it's just more comfortable for people to do it under anesthesia. Mm-hmm.